So if the hospital systems are overwhelmed, the job for our practice and our telehealth services is to not only provide routine care through video chatting like this, to be able to still manage your COPD, maybe even check in on your lung cancer treatments, or still coordinate that from a distance and still effectively deliver that care, but also identify patients that may have COVID-19 so that you don't just get up and go to the hospital, even though you're totally stable and fine, just with some mild symptoms. Those types of patients, we really want to encourage the shelter in place so that the very sick ones that may require intensive care or further aggressive care with an inpatient admission and need a hospital bed, we want those patients to have the ability to come to the hospital and have care. And then finally, the piece of this that's really important is protecting the healthcare providers, the nurses, the nurse practitioners, the doctors, the technologists, all the people that make a hospital system work or an office practice work. We want to limit our risk and our exposure so that I can still be interacting with sick patients and making recommendations and treatment plans and coordinating a patient's care without taking me out or taking the staff out. The beauty of telehealth and the lung docs and our practices, even if I was quarantined or my staff was quarantined, we have now, and I have mild symptoms, of course, we can still deliver care through telehealth during a quarantine period. So, like I was telling someone earlier, the job really of telehealth is to, that this is a time in the nation where we have to sacrifice some of our freedoms and privileges for the better of the country and the better health of our elderly and our patients, and not be selfish. So it's time to be selfless.